Hi everyone. Hi everyone. Welcome to Center of Balance Live. Hi everyone. Welcome to Center of Balance Live. I'm Szenan from Center of Balance, the acupuncturist. Just making sure that all platforms working. Well, welcome to Center of Balance Live. I'm Szenan from Center of Balance, the fertility acupuncturist and fertility Chinese herbalist. Today our topic is male infertility causes. Male infertility causes. Seems like it's not working. One of the platform that should be maybe all right. We're just waiting for it. Now, if you're up on this or if you're watching this live video, oops, a minute. Let's see. Well, my Instagram wasn't working, but now it's working. Should be okay now. And one of the YouTube channels not working. Let's see if I can get it work. Then it will save me a lot of time afterward to try to upload those videos to YouTube. Okay, so if you on Facebook or Instagram, there's another way to get to our platform. My live video, my daily live video. That's on YouTube. Right, you can search my name on YouTube, and that's a word. Nope, not working. My other computer is too slow. Right, that's okay. But we just have to upload it later. Right, so YouTube won't miss any of my live video content. If you are on live now, please say hello to me so I know who you are. So where you're from, and you acupuncturist or you a non-acupuncturist, are you practitioner or not really? Just letting me know, so I would like to know you. Okay, I would like to know my audience who's watching my live video. All right, thank you very much. So our topic is male infertility causes. So you can see that Hassan is on Facebook now. Hi Hassan, happy day. Hello. Veronica, hi, how are you? Little Apple and Instagram, just wait. Okay, good. All right, and we got Ada Inca. Nice to meet you. And Eric, hi, how are you? Good. All right. So our main topic today is infertility, male infertility causes. All right. Then, if you're on Facebook, can you please apart from saying hello to me, I've seen you all. You're doing a great job. Thank you. And give me a thumbs up. Give me a thumbs up. And as well as tag your colleague, your family, your friends who need to know or who suffer from infertility into this column, into this live video. And also share with your friend, share on your platform. Okay, I'm just doing letters, male infertility causes. This on my YouTube channel. It's one of my YouTube channel that is just because my computer ran out of battery. So now I try to set it up. Hopefully it's fine. Okay, let's go live. If that's the case, I can shut down this computer here. All right. Thank you for being patient with me. Now, okay. Yep, my other platform is going. It's on now. Good. Hi everyone, I'm Szenan from Center of Balance, the acupuncturist. Today, we're going to talk about male infertility causes. Right. Now, any of you, if you're a practitioner, how many of you are treating infertility? How many of you are treating infertility? If you are treating infertility, please reply yes. Yes. Okay. Please reply yes. Right. Now, if you're not treating infertility, that's okay. That's okay. You're here, that's good. Because if you're not treating infertility, but you're interested in treating fertility to gain more knowledge, please say yes. Okay, I can see Veronica say yes. Okay, good. Now, if you are interested in gaining more infertility information, you put down infertility information. Can you reply me infertility information? If you're not currently treating infertility, can you please reply me infertility information? So the reason I asked you to do this is I want to know how many people are interested in infertility topic. Okay, this is what I know. Of course, another thing is marketing things. What is marketing things? Is if you put it on my platform, say infertility information. If anyone search on Google, they would like infertility information, then it actually Google help my search engine. The Google search engine help to provide this information, the keyword infertility information, to other people that my video talk about this. Okay. So when you think about bringing yourself to others, you need to think about how Google works as well. So it's just sharing my a little bit of my knowledge of marketing skill. Thank you. Always want to share. Okay, I have a lot of managing clinic stuff that I would like to share in the future. Okay, I have a wonderful manager who's managing my clinic for me, and it's been wonderful. And therefore I have more time to do live video and share my knowledge with you and my experience. Thank you for replying. All right, let's start. Causes of male infertility. This is our topic. So generally speaking, infertility in men is related to issue with the following. Okay. Now you need to understand one thing is why it's so important to understand this, because when it comes to infertility, it's a couple things. It's not just one people thing. Okay. Back there in Chinese culture, in Chinese history, we have a thinking that this is a bad idea. stuck in our head. The majority of people think of that way. When it comes to infertility, it's all woman. It's all woman fault. This is not. This is not. So if you are female, you need to understand. And if you're a male, you need to understand too that infertility is a couple of things. And when it comes to infertility, 1/3 of issue is female infertility. The other cause of issue is from male infertility. So equally important. Then another third of it, we talk about that. Another third of it is female and male infertility combined together, as well as some unknown causes. Okay, according to Western medicine. So as you can see, this is equally important. So to understand male infertility is rather important. Okay, so you don't just treat the female infertility. You don't just provide treatment and get female to get healthy and don't bother of male. That is very, very wrong. Okay, so if any of male thinking, well, we can get pregnant, it must be my wife. That is totally wrong. Okay, that is a bad idea for you. Right now, we see some patient divorce due to because infertility. So you know that infertility, if you save, it could save a marriage. That's what I want to talk to you. I want to bring it up because I have patients, they try, and then a lot of stress, and in the end, because of infertility issue, they lead to divorce. Okay, this is true. Okay, now in male, the effective production of sperm is important. Now, sperm need to keep producing, so that is very important. And so the amount of the sperm count, the number of sperm is important too. So you need to check this. So if it decrease, of course, you decrease the fertility rate. Okay, and the shape of the sperm. So a sperm got head and body and the end of that, right? So that shape, if it's wonky, if the shape is not properly, then this sperm hasn't got its function. So by looking at the shape is important too. So this is we call morphology. Okay, in the text. The movement of sperm is important too. Now, if the sperm, there are two different movement that we're looking at. One is wiggling. So there's a head and there is body, and the body need to wiggle like this. Okay, so just like snake, snake wiggling the in the body, and that they can go forward. Okay, one is wiggling, one is forward. Why we say, but don't get a wrong idea. I used to get a wrong idea. When you wiggle, you must go forward. No, it's not. Why is that? Because getting forward is one of the movement. Wiggling is second movement. The first movement you need to wiggling. Without wiggling, you can't get forward, right? But with wiggling, would you definitely get forward movement? No. Wiggling can be just circle. It push, it move. Yes, it move, but it moves circle itself. It never get forward, and that's another problem. So when it comes to sperm, it need to wiggle and as well as getting forward. Wiggle, getting forward. This is the head of it. Does it make sense? Yeah. If you wiggle and keep doing this, it doesn't help. Okay. So that is mobility. That's the mobility. Okay. If someone will just wiggle, but it doesn't actually go forward or go around, and that's another problem too. Okay. Now there are variety of risk factor, medical conditions, and medication that can also affect male and fertility. Okay. Now, why is that? Now, in female infertility causes, we talked about yesterday, right? This morning, we talked about the risk factor. We talked about medication and medical conditions, right? Some of the medication and the risk factor are similar, but when it comes to medical condition, it's very different, very different with between female and male infertility causes. Let's get to the first one, the risk factors. The risk factor is age. There's also similar, right? Age, right? But it's pretty lucky for men, to be honest. Is you may see that a men when they to 50, 60, 70, even 80, they still have the function. They be able to uh, um, uh, make a woman pregnant, right? Because the sperm still useful. But in reality, yes, that is right. Not like woman and 40 something, 49 according to Chinese medicine, 49, and then you go to menopause. Menopause. If you finish your period, then basically your reproductive system gone. Okay, the men it came up to 80, but in reality, more people in men, when you age, the sperm quality actually going lower and lower as well. This is the same as female, same as female. Okay, now some other same factor is smoking. Why we talk about smoking and female infertility? Because the idea is very simple, right? Well, we use the blood, uh, especially in Chinese medicine. We talk about blood a lot, blood circulation. You know, Ali said, please can you explain what to do? You mean jacking or jump? I don't understand your question. I'm sorry. What is? Uh, I'm sorry, Ali. I'm not quite sure what you're talking about. Um, question. Let me. What does it mean? Darwin. Darwin. What was Darwin? I am not sure about the word of Darwin. If any of you know what the word of Darwin or Darwin, can you please explain to me a bit more clearly so I know what exactly the question is and I can. Once I understand the question, I will. Darwin. Did I say anything, Darwin? I'm not sure what Darwin is. Sorry. Did I say that word? He said, please can you explain what do you mean Darwin? I've no idea. Did I mention that word? Yeah. What does it refer to? Refer to what? Male infertility, sperm. Yeah. So I'll keep going, and then you type it on, and I'll review it later. Okay. I'll give you an answer if I know what's going on. Thank you. Thank you for your patience, Doctor. Oh, you're asking Doctor Juice. Okay. Tao Ying. Okay, Tao Ying. Dr. Zhu's method. Dr. Zhu's method, Tao Ying, is when you needle it and you do Dowing is 动气, like master tongue 动气, okay? Dowing, when you needle it and you move your arm, this exercise called dowing, okay? When you needle it, needle the scalp, and you needle the body acupuncture, and the body acupuncture called dowing. When you needle scalp acupuncture, then you ask patient to sing, you know, and you tap on patient's body, and you ask patient to do meditation, think positive, and you talk to patient. This all dowing. Anything that when you after needling, you get patient to do and try to improve the treatment, speed up the treatment results, that's called dowing, to make the treatment even further, to make the qi and blood go to whatever you want to go to the body part. Does it make sense to you? Okay, well, we are talking about male infertility issues, okay, the causes, okay. If the next time you want to ask the question, you're allowed to ask any question you want, make it more clear, because I thought you were talking about male infertility. Sorry about that. So yeah, if you talk about, when you mention about Dr. Drew's method about dowing, then I know, because I don't know. I thought you're talking about male infertility. Yeah. So if you can make it more clear, I straight get it, the question, and it'll help a lot. Thank you. Yeah, when we talk about blood circulation, right? That blood circulation in men is important too. You can't go without blood circulation. Right? Too hot in here. You can't go without blood circulation. Doesn't make sense. So, what is the blood circulation that help people to heal? That's not just in female infertility. We talk about female infertility, right? Now, that's including male infertility too. Now, the blood, it can bring the nutrients and the oxygen to support sperm, to get sperm develop better, to help production of sperm, right? Does it make sense? Now, if you smoke, what happens when you smoke? You smoke, the chemical go into the blood, because the oxygen go through the blood too, right? When you smoke, the chemical go into the blood. Then the blood had toxin. The toxin is not good for sperm. That's been proved, right? Then what else? Of course, a lot of people smoke, they still have the baby, right? But we are talking about, do you want a healthy baby or not? If you're not talking about, if you're just talking about, I want a baby, I don't care about this healthy or sick baby, then that's okay. Go and keep going with the smoking, because this is your choice. But I'm here to give you information. I'm here to let you know that studies show that smoking that affect the sperm, smoking that affect the quality of the eggs, right? And that's up to you. I'm here to share information, right? Now, one more thing. So you think about the chemicals. This is one thing, and the second thing is you get oxygen into your blood through your lung, right? If you smoke, have you ever seen the smoking lung and compare with the non-smoking lung? It's totally different. When the smoking lung, which means people get they can't breathe properly. When they can't breathe properly, they can't get enough oxygen into the blood. When they can't get enough oxygen to the blood lack of oxygen. So how could the circulation go to the tissues to heal your body, to help your sperm quality? Now, you lack of oxygen. So smoking is not good, totally not good for not just sperm production, eggs, any kind of disease. That is why we ban smoking. Does it make sense to you? If it is, please say yes, it makes sense. Smoking is not good. If it makes sense to you, please say yes. Reply me yes, it makes sense. This is a simple way that I explain to my patient, and I'm here to explain to you. And you can use that because when it comes to Chinese medicine and medical term, people would say, well, smoking is not good, but why is that not good? Use a simple thing, easy, understand things to explain to your patient so they get it. If they don't get it, I'm sorry, they won't do it. If they get it, they know what's going on, then yes, they may, because some of them just don't care, they don't want to do it. Does it make sense? Okay, heavy use of alcohol. Now, alcohol, I always ask it, when the kid is, they are still young, and you say that, well, as a kid, you're not allowed to have alcohol because alcohol will damage your nerve system, right? Then the question is, are you saying that when you're older, you can get alcohol and the alcohol won't damage you? That is totally not true. Doesn't matter how old you are, alcohol will damage you. So we ban alcohol too. When it comes to infertility issues, then no alcohol, because there's a lot of proof about it. That alcohol, again, get into the blood, affect the production of sperm. All right? Especially when you heavy use of alcohol, that is not good. Okay. Now, exposure to toxins such as pesticides, okay, herbicides, and heavy metals. So all this thing, pesticides is way. If I'm not a farmer, I won't only get it. Pesticides and herbicides. In what situation that we actually contact and related to pesticides and herbicides very closely? Do you know that what we eat, all the vegetable that we eat, so organic is the better way to go, or grow yourself and get local seasonals, vegetables. This is important too. And heavy metal, and when it comes to heavy metal, I want to, when you feel your teeth, and there's something in the teeth that's made out of heavy metal. My wife got her one or out. They're not good. So this is important. Now let's move to medical conditions. So some example of medical condition that can cause male infertility, that including retrograde ejaculation. What does mean retrograde? Retrograde ejaculation, which a man ejaculate, the sperm go out, passing out from the body, right? And this type of ejaculation is actually going opposite, and actually going to the bladder. So of course, this is not going to help fertility, right? So that is just, you need to understand this. If the patient tell you about it, retrograde ejaculation, then how do you treat it? Acupuncture can help. Okay. Varicocele, that's another, the veins swollen. Then the veins swollen around the testicle, and there's another issue for that. Right? That's abnormal. Okay, that testicles that haven't descended into the scrotum. So I talked about yesterday. I'm not whether you still remember or not. A male, we talked about female infertility cause, right? But I did mention it. But I maybe mentioned it in the Chinese live video. I probably didn't mention it in the English live video. Maybe I did too, but I can't remember, because I do 2 live video on the same day. So one same topic, morning is English, nighttime is Chinese. But sometimes I do a bit different, and I talk more on this, less in the other one. I don't know. Hi, Dimitris, how are you? And Branka, how are you? So it's too far to reach the Instagram iPad that I couldn't say wave to you. Yeah, forgive me about that. Okay. Yes, it makes sense. Yeah, good. Thank you, Veronica. Yeah. Yes, thank you. Adi said thank you. Dr. Szenan, you are my master. Thank you. Thank you. Okay. All right. Um, so the sperm actually, our body temperature is too high for the sperm to survive. That's why the scrotum in male, it doesn't actually attach to the body, but it's away far away from the body, right? So the testicle is actually on the scrotum, and it actually doesn't close to the body. Okay, so wearing underwear is important in male, right? We wear boxes, like you know, boxes underwear instead of those cool one, and those are not very good for sperm because it put your testicle close to the body, and that temperature is too high, and as you kill the sperm. Okay. Okay. Having antibodies that attack your sperm and destroy them. Well, antibody there's another problem. Your body actually attack your sperm yourself and destroy them. So what can do about it? Can we do about it? Can acupuncture and Chinese medicine treat about it? Yes, it definitely can. It definitely can do that. Okay, you can improve that. But when it comes to Western medicine, there's nothing they can do. What can they do? They try to take it out and do IVF. Even IVF, if it destroys a lot, that's very difficult to do. And no, in Chinese medicine, we can help with that. Right? We can definitely help with that. We have solution. A hormonal imbalance such as a low um, testosterone production, and that's not a problem too. Men, you need that hormone. Okay. Medication and drugs. Various medication and drugs can also affect male fertility. Okay, the common one, radiotherapies and chemotherapies, which is used for cancer, right? So I have a patient who had cancer and liver cancer, and then it was treated and was okay, and then fine, and then a few years that transfer the cancer came back again, and they were planning for a baby, and he was going to do chemotherapy. And what happened is, you know, if this case come to you, I'll tell you, hey, do IVF. You can do faster than what they can do. This is what IVF valuable earn. Okay, so in Chinese medicine and acupuncture, you need to know what you can do, what you can help people. Okay, you don't just say, "Well, we are the best, we can do everything." This is not the case. This is not the case. When it comes to this case, like this patient, when they came in and he mentioned about they are doing IVF now, and they didn't come to me for fertility. They come to me actually for pain relief from the cancer. And the wife actually came for acupuncture, doing the way wife actually came first because they want to do IVF and just get sorted for IVF, and then the husband come afterward, and we become friends actually. Um, I still remember his face a few years ago, 2018. So it's not long ago, but 2 years ago. Um, then he went to chemo because he went to chemo, and but he need to get chemotherapy, right? And so he get sperm, store the sperm first for IVF, and then he quickly went to chemotherapy. So this is something that we Chinese medicine we can do faster than IVF, and we can do it naturally. And ended up they're doing great job, and they had a baby. Okay, but this patient, the male patient, he had a baby, and then there's an option in Australia that came up with a free treatment for him, and he flew over there, and we still keep in touch. And after a few months, that I lost contact with him. He was too sick, and he emailed me a few times, and he actually wrote a book about himself, how he born and went to UK and Australia, how he worked there, and what he did. He did a major job as a builder. Then he came back here and what's happening, and organize a, work very hard and with a lot of toxin around him as well. Then how he ended up to come and see me, how the acupuncture helped him. He put my name in the book, and he was trying to send the book to me to review, and I didn't actually see the book. I'm not quite sure whether he was trying to write down for his kid actually. Yeah. Then what happened is we lost contact in after a few months, and one of his friends and came to our clinic and for treatment, and she mentioned that he actually passed away in Australia. So that's very sad. Yeah. Okay, some drugs that it's called sulfasalazine, actually for as a drugs is used for rheumatoid arthritis and also ulcerative colitis, and we know rheumatoid and the colitis issues actually autoimmune system disorder. So this drug is using for them, and this is actually has harmful to the sperm. Okay, antidepressant as well. One of them called glycolic and antidepressants, and they are not good for sperm. Okay, and steroid. Okay, some of the steroids are not good for one of them called anabolic steroid that's used for athletic performance or hormone issues such as delayed puberty, puberty, those affecting the sperm. Okay, this you need to know that. Okay, recreational. So those drugs that we just mentioned is not everyone. Okay, it's more common one is people use recreational drugs, such as cocaine and marijuana. This is commonly known that actually affect in male and female reproductive system. Okay, sperm and eggs. So you need to understand this. Okay, so yeah, with the drugs, you need. I have nothing more to talk about the drugs. It's just that I just name it to you, and so you refresh your memory. If you're a practitioner, you are in treating infertility. But for those of you, when it come up, the patient tell you what they use. Simple, just put it in Google, and that Google search for you whether it affect the male fertility or female fertility. It's simple. Just put in Google and do a research. Because as a herbalist and acupuncturist, you don't know all the drugs. It's a patient as well. When it comes to infertility, you need to review all your drugs. Get all your drugs out, type it in Google, because I believe in that is the truth that your doctor, they won't tell you that. They never tell you that. Even though they know it, they didn't bring the message information to you at all because they don't want to scare you. And as you, a practitioner, you need to know, Google it. If you're a patient, you need to know this, Google it. Google helped this a lot. And yes, people say, oh, do not ask Dr. Google. I said, well, in some level, you always ask Google level, we all doing this, but when it comes to properly diagnose, you don't ask Google. Okay, you need a practitioner too. But to gain information, to gain all this drugs information, go for Google. I do it too. I do it too. Doesn't make sense to you, right? Now, bottom line, every of this thing that we just mentioned about, okay, or even a combination of them could lead to infertility in men. All right? Okay, does that make sense to you? All right. Now, this is what I want to tell you about the male infertility causes. Okay, now I see Ali say I will send you a video on WhatsApp about frozen shoulder. I treat one patient with Dr. Chu's acupuncture. Okay, thank you. Yeah, Ali, Dr. Szenan has a good technique for treating frozen shoulder. Yes, yes, I share with Veronica. Yes, the very good technique that I share with Veronica for frozen shoulder, and I only share with my student in my workshop. And it, when it comes to acupuncture, you have two type of acupuncture that in me. One is one needle technique, one is multiple needle technique. Okay, now I know more people will say, well, less needle you do, the better, because that can tell that how good is the practitioner. But in reality, one needle technique cause more pain. Okay, in reality, one needle acupuncture, because it must do some technique, and multiple needle cause less pain. You just put needle in, you don't have to twist it, you don't have to do this movement, but it works the same, or sometimes it works even better. I'm not saying that they are different too. Okay, uh, one needle thing sometimes it works better than multiple. Okay, so it depends on different conditions. We need to use different technique. Okay, when it comes to frozen shoulder, I use multiple needle techniques. Okay, and I've been proved for many times in my clinic. I tell you, I've seen a lot of master, and they said about how good the technique is. And for frozen shoulder, I'm sorry, no, that's not the case. I follow a lot of master, and I used all the technique, and I tried, and I felt again and again and again. And of course, I do get those techniques to work for some people. But when it comes to range of movement issues with frozen shoulder, it's difficult one. And you must do Taoying. Without Taoying, just needle, I'm sorry, that doesn't work. It doesn't work. No matter how good your technique is. If it's just pain, for frozen shoulder, if it's just pain, you bring it up, you show range of movement is all good, it's just pain. Any acupuncture technique can treat the pain. But when it comes with pain, severe pain, with range of movement, a frozen or the shoulder frozen, you must do Taoying. You must ask patient to move the hand, or you help the patient to move, do the movement, do the physical therapy movement. With physical therapy, they refer the patient to me too. Okay. Without acupuncture, they just try to move it themselves, too much pain. They couldn't do that. And the best combination is acupuncture and physiotherapy joined together. And of course, as an acupuncturist, you refer your patient to physiotherapy. You can do that, but the physiotherapy don't know how to needle them, and they keep providing the exercise and keep wrapping the massage the sore area. It helps, but take a long time and difficult. And some of them too much pain, they couldn't do it, you know. And we do very worst case, they couldn't do anything on the arm. They said, oh, so painful, oh, so painful. Just a little movement, or put needle in, still painful, keep moving. And the range of movement eventually get better and better. You take the needle out, it'll come back quickly. No worry. Just tell the patient it's gonna work, it's working right now. Just keep coming and do the needle, and you keep treating. It goes better and better. One day, they're free of pain and they can move. This is my experience. Okay, Trigenic is one of the best treatment for this, and you can Google Trigenic and YouTube. A lot of video. I learned one. We have one of video, and provide this Trigenic. For frozen shoulder, is very good technique, and that's very expensive in Canada. Dr. O, I can't remember all what. He charged 1,000 for one treatment, right? And Lundy charge in here in our town 600 for one treatment. 600 one, not just one off treatment though. a few treatments. Some of the case for few treatment. Okay, so not just one-off treatment. But for acupuncture, I have some patient that been to Lenny fixed, very good, but he retired. Then he got another arm of frozen shoulder after a few years, and he couldn't afford 600 per treatment. You know, he couldn't afford it. So he came to me, we put needle in with my technique, and then bang. After 6 treatment, fixed. The 6 misuse treatment cost him how much? About 600. We charge $100 for acupuncture. So if he would go to the Lundy for the frozen shoulder, if Lundy get 1 fix, and that's good. If get 2 or 3, then it's more than 600. And he know it, not just 1 fix. So he came to us, 6 treatment, $600 for the shoulder, gone. There's another way. There's always another way. And acupuncture, yes, acupuncture can help frozen shoulder, but in reality, difficult case. I practiced for many years and try to get it right, and keep doing it. Finally, we got the answer. Okay, I'm not saying that I can treat all the frozen shoulders, but I say this is the method that so far I found it it's effective for majority of frozen shoulder. I haven't had any cases that I can't deal with so far. Okay, I just say so far. I don't know, maybe tomorrow, next week, I got another very hard case. I really can't deal with it. Okay, but so far, every cases they recover. Okay, all right. And of course, I'm not treating frozen shoulder every day. Right, so my rate is 100%. Is not very, but it's valuable if there is frozen shoulder. It's very bad that you treat it in successful, because this experience is very valuable. Okay, it's case by case. All right. If you think this is valuable cases topic, and please help me with my Google search and type on Szenan. I'm doing marketing right now. Male infertility causes is very informative. Thank you very much. If you type that, it'll help Google search on my topic. I'm trying to get my view of my the live video pump up on Facebook, as well as on the YouTube as well. Okay, now on Instagram as well. Please help me with that. Thank you very much, and stay awesome. I'll see you tomorrow. See you. Thank you, Veronica. You always helping me and support me, and leave me comment, and send me a thumbs up and everything. And every day I see you, I'm so happy to see you. And thank you very much for your support, team. Have a great day. I'm going to the temple today. Bye bye.